the Health Information Bill 2024, a step towards modernising healthcare in Ireland. It's a big statement, certainly, and I welcome the bill because we badly need to modernise the health system in Ireland. The Health Information Bill 2024, published on July 19th, 2024, aims to establish a legal framework for digital health records in Ireland and set guidelines for sharing patient data for care and treatment. The bill is a significant step forward in addressing Ireland's lag in the digital healthcare compared to other EU and OECD countries. Indeed, we fared terribly in different surveys with OECD countries, and so it's shameful, really, especially when we are outliers there, when outliers in as regards digital and digital economy, and indeed so many data centres and God knows what else. And here we are with an archaic system with paper folders going around and papers. And only recently I was in a hospital, actually. It's ironic. It was to me to sign, as a police commissioner, sign a form for a patient who is unable to speak and that. And she was able to use the computer, so I took out my pen and it was blue, and or it was black. Sorry, it was blue. And she said, "No." She typed in, "We need a black pen." So I went to the nurse's station. Two of them actually, to be told that they don't use any black pens. It's all blue or red. It's all allowed. But it's interesting what you learn in a day's work. But that's aside. This situation regarding this bill, comparing, as I said, digital healthcare across the OECD countries, Ireland ranks lowest in several key indicators of digital readiness. And that's an embarrassing situation for us to be in at this point in time. I mean, it's such a nightmare, that people should be able to get access to their records within minutes. And indeed, the Minister admitted himself. I was in the chair last Concordia when he spoke to the House at the initial stage of this bill, like the case of someone who was waiting, I think 6 weeks, he said, or 8 weeks recently. And that's not acceptable. So, I mean, you need fingertip information now to be able to act swiftly and share the data and have it if you're in a different part of the country, in a different hospital or whatever. You should be able to access it in a very, very timely session. Not like that. So Ireland has been significantly behind in the digital healthcare. It's one of the only 4 EU members states that do not provide citizens with access to electronic health records to a centralised service. And there's so much to be done. And I'm not blaming the staff in there, and but goodness, they're busy enough, but the systems need. And the whole situation with the papers going back, that fiasco, I think 60 million was flushed down, or 50 million was flushed down where, and that disaster. But the problem is, Ms. Ayers, I think at the time, nobody gets held accountable. Nobody held accountable for any of these situations. And it's a sad situation in a democracy when there's no one held accountable. I mean, the Secretary-Generals of the Parliament and the ministers must be held accountable and have to be held accountable. And that has gone totally out of this House and this government, this state. The potential benefits of improved patient care, digital health records will enable better coordination and continuity of care, leading to improved patient outcomes. That's a given. Enhanced health information. The bill will facilitate the use of health information for public interest purposes, such as policy making and regulatory activities and statistics. Regional data sharing, as I said, is so important and so vital. So, Minister, we'll be looking at this and assessing it, and we hopefully will be putting down amendments, because there are weak points in it, and I'd like to see a timeline at this 11th hour now, this government, as to when it might be its passage, or when it might be enacted. That's another situation. We can pass through the houses here, and it can take forever and a day to get to be implemented. So our system is creaking and badly broken, and we need legislation like this. And I do welcome, as I said, and I do think that Washington the Rural Independence will be submitting amendments to this, and hope they'll get favourable, and we will have adequate time to discuss them. Thank you.